Bladder 64 is located distal and inferior to the base of the 5th metatarsal. If you palpate along the lower part of the lateral border of the foot, you'll find a bump. This is the base of the 5th metatarsal. Locate this point just distal and inferior to the flare of the bone.
Do14 is on the posterior midline, below the spinous process of C7 in a depression. Bladder 54 is on the buttock, 3 cm lateral to the sacral hiatus. Typically, if you put your hands on the sides of the buttock, it is midway between the sides and the gluteal fold at the midline.
Small intestine 14 is located 3 cm lateral to the inferior border of T1. Locate your T1, move 3 cm laterally. The 3 cm at this level is dictated by the medial border of the scapula. Large intestine 15 is located anterior and inferior to the acromion process at the origin of the deltoid muscles. The easiest way to find this point is to take the weight of the person's arm, extend their arm and palpate for the clefts between the anterior, lateral and posterior heads of the deltoid. If you push medially, you should be able to feel the bony extremity of the acromion process. You need to locate this point inferior to the acromion process between the anterior and lateral heads of the muscle. Mark this point when the arm is then relaxed. Gallbladder 21 is located midway between Do14 at the base of C7 and the lateral extremity of the acromion process, but at the crest of the trapezius muscle. To find the crest of the muscle, it may be necessary to dip down slightly to make sure you get the highest part. This point forms a line with Sanjiao 15 and small intestine 13. Gallbladder 21.
Ren 12 is 4 cm superior to the centre of the umbilicus on the midline. Ren 15 is 7 cm superior to the centre of the umbilicus on the midline. Kidney 21 is 0.5 cm lateral to the midline at the level of Ren 14, which is 6 cm superior to the centre of the umbilicus. Liver 14 is 4 cm lateral to the midline in the 6th intercostal space. When you locate this point, make sure you are in the intercostal space, not on the rib. Liver 13 is located just anterior and inferior to the free end of the 11th rib. To locate the free end of the 11th rib, palpate up the lower margin of the rib cage till you get to the first free floating rib, which is the 11th. This point is never inferior to the umbilicus and never posterior to the mid-axillary line. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 cun proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief.
Pericardium 6 is on the flexor aspect of the forearm. It's 2 cun proximal from pericardium 7, and it's in between the 2 tendons palmaris longus and flexor carpal radialis. Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7 and between 2 tendons, palmaris longus and flexor carpal radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpal radialis. So finding heart 7, articulate the wrist, coming between those 2 tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those 2 tendons. And just relax again.
Pericardium 8 is found on the palmar aspect of the hand in this nice dip which is proximal to the junction of the heads of the second and third metacarpals. The point is just a little closer to the head of the third metacarpal.
Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpal ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in.
Stomach 36 is located approximately 13 sun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 sun inferior to the inferior border of the patella. Stomach 44 is located half a sun proximal to the web margin between the 2nd and 3rd toes. This point should fit nicely into the flare of the base of the proximal phalange of the 2nd toe. Spleen 6 is located 3 sun superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Kidney 7 is located 2 sun directly superior to kidney 3. Locate your kidney 3, move up by 2 sun and mark this point directly on the anterior border of the tendocalcaneus.
Gallbladder 30 is in the posterior lateral aspect of the hip. It's at a junction from the anterior 1/3 and posterior 2/3 of a line taken from the prominence of the greater trochanter and the sacral hiatus.